Hi, it's Tara. Um, so I actually just did a video and then I realized that my volume was completely turned down. So I've kind of lost my steam here. So this is going to be a little shorter than my last video, but I wanted to get this out because I feel like if I don't get this out now, I'll never do it. So it has been a little while since I last recorded, mainly because I really haven't had any updates. So there hasn't really been anything new to talk about, but I did have an appointment this morning with a new facial plastic surgeon in Boston. My previous doctor over at Massachusetts Eye and Ear Hospital left the facial nerve clinic. And so I was left looking to find a new provider. And thankfully I have, out of a Dr. Hadlock out of Boston. So I just had my first appointment with her today. It has now been 19 months since I was diagnosed with Lyme's disease-induced facial palsy. And so, so I had the appointment this morning. We kind of discussed, what are my top concerns right now regarding my condition. And I said that my main thing that I would love to address is the fact that I still can't fully blink. My right eye here, as you can tell, I have some blink, but definitely not a full blink, which is meaning that I have to use eye drops still pretty regularly because my eye gets dry. I was thinking that we were going to discuss an eyelid weight in order to help with that closure, but she thinks that because of my synkinesis, so that kind of tightening of the muscle fibers, and obviously you can see how my eye, when I smile or when I talk, it kind of wants to close involuntarily, that doing the eyelid weight would actually make that worse. So her recommendation is that I be more consistent with doing the physical therapy exercise of holding my eyelid shut and then with my other hand pressing on my eyebrow and doing that twice a day for 60 seconds. She said that's going to probably be the best thing for me to get some of that closure back. Now, obviously with that, so you can even see it now, it's better. It just goes away over the course of the day. So I'll have to just be better about doing it more regularly. It's not a permanent solution in that I have to just, stay on top of it in order for it to work. But it's obviously, it's not a big chunk of my day that I'm dedicating to it. And if it helps with my eye closure, then I'm going to be better about being more consistent with it. So that's one thing. And then the other thing that we discussed is my smile and some of the tightness. So what she wants to start off with, I think it's kind of a gradual approach to getting me to my best self with this condition. So this morning, she actually put in some Novocaine in my kind of face here and a little bit over here. I believe it's to kind of mirror what it would be like with the Botox in, or with cutting some of the muscle fibers that are now overly constricted due to the synkinesis, cutting them, and what would happen to that, softening of that smile muscle in order for me to regain some of my smile. So right now you're seeing me about an hour and a half post Novocaine. So I can still feel a lot of, I still can feel all the Novocaine in my face. But it was amazing because even immediately after she did it, I could finally see these teeth. I haven't seen these teeth, so I'm going to smile real quick. I'll show you what it looks like. So obviously, again, see my eye, you can see, it's definitely not normal. My face over here is pretty, what it would be like normal. And then over here is different. But I have not seen these teeth in a smile since before my condition. So it was kind of a bittersweet moment. It was a little bit of a moment of really kind of recognizing, wow, what a journey this has been, and what a challenging journey this has been. I don't really think about having facial palsy on a day-to-day basis. I mean, it's obviously always kind of the back of my mind, but I've had it for so long now that it doesn't really impact me day to day. But going to these appointments and having these experiences is a reminder, of what I've been through. But the good thing is that doing that helped. And so what she wants to do, the doctor, is she wants me to go back in a couple weeks and do another round of Botox and then go back 2 weeks later. So when the Botox is really kind of taken effect, and do this, I forget what she called it, but basically she's going to go into my cheek and she's going to snip one of these muscle fibers, the one that's causing the pulling and keeping my smile from being able to smile normally. My smile is not going to come back normal, fully 100% from doing this, but I'm confident that I'm going to get something back. And after kind of probably in a lot of ways resigning myself to the idea that I may never have a smile again, it's optimistic and encouraging to think that I might have something back. So yeah, so I will keep you posted on how that goes and give you an update after that happens. So yeah, so it was a good appointment. It's always a little emotional for me, to be honest, to go to these appointments. I think it's sometimes easier to not deal with what's going on, as opposed to have to face it head on and kind of, deal with some of the hard emotions that come with, what I've been through and everything. But obviously, if the end goal is to get my face back to as, quote unquote normal as it can be, then I'm going to have to, face these moments. So yeah, so anyway, that's just a quick update. I hope that if you are on a journey with facial palsy, wherever you are, that you are, I don't know, being strong, but also allowing yourself to feel, the challenging feelings that come with something like this. And I hope, if anything, that these videos encourage you. I know it might not be always great to see somebody that's this far into something like this, but I, want you to know that that I'm okay and I'm happy, and my life is good, and I've adjusted to what's going on. And so even worst case scenario, if you are, in a situation where you have something like this, this long out, which I hope that you don't, but if you do, it's going to be okay. And yeah, so that's it. I hope everyone's well, and I will keep you posted on my next procedure. Thanks.